Letitia! I recently got my second IUD done, and who else but Letitia would do this, but decided to publicize it on Insta Story. Then got a flood of DMs. People were asking me a ton of questions about it, and I decided to make a video. And since I got those questions, I was like, why not vlog it? The upper part of me. So all you creeps, there's only the top half. Mostly double chin shots. This is a huge warning. Please consult a medical professional. I am not a professional. I cannot give you medical advice. I'm just sharing my experience. If some of you don't know, I have endometriosis. I recently had, no, not recently, 2 years ago, got surgery for it, and I have been maintaining with an IUD. So my first IUD was the gynecologist, which is a 3-year IUD, and I tried it because it was the first attempt to control the symptoms of my endometriosis, heavy periods, heavy cramping, ovarian cysts, and I had tried a bunch of different birth controls before. The process of me getting diagnosed with endometriosis, that's a whole other video that I'll make. How did you decide this was right for you? I've used different types of contraceptives, from condoms, birth control pills, the NuvaRing. Birth controls reacted little, either horribly or little to nothing, and periods were still just as heavy, just as irregular. NuvaRing, same thing. It looks like a jelly bracelet. You put it in and you don't feel it. And that's also a great alternative, but I also don't think it did much for me. I don't quite remember. When I finally landed with my angel gynecologist, and I would never say that about a guy because I'm very uncomfortable with male doctors, and our whole process of treating endometriosis has led me to this point. So post-surgery, and my gynecologist has expired. Now it was time to decide what I wanted to do, and taking daily hormone pills, which is different from birth control. It's like not a contraceptive, but it's a hormone pill that is meant to help with my endometriosis symptoms. It's not practical. I'm really bad at remembering my pills. I was very happy with my gynecologist IUD, so then I decided to get the Kyleena. So the Kyleena is the exact same size as the gynecologist. From what I know, there's gynecologist, Kyleena, and Mirena. And gynecologist and Kyleena are the same size. Mirena is a little bit bigger, and it's better suited for women post-pregnancy. The difference between gynecologist and Kyleena is that gynecologist is 3 years, Kyleena is 5 years. And I was like, perfect. If it's the same size, the exact same dosage of progesterone. According to my gynecologist, I didn't have to worry about my body getting used to it, and it was a seamless transition. I know that there's a lot of scares about IUDs, insertion, infection, falling out, feeling it, cramping. How do you get it and what's the process? In Canada, you go to a family doctor, you ask your family doctor to refer you to a gynecologist, and I would go to your gynecologist and speak to them, see what the vibes are first, maybe get a pap smear and ask them a few questions to see and gauge if you're comfortable with them. If not, Ontario has a lot of sex clinics. Let's hope Doug Ford doesn't kill them all, but they have a lot of sex clinics, and those professionals have been very helpful when I was a teenager, and they do IUD insertions all the time, so they actually could be really good at IUD insertion because they do it all the time. They have a lot of practice. Can't guarantee it, but find a gynecologist that you're comfortable with first. Get the prescription. When you get the prescription and pick it up from your pharmacist, you bring it with you to your appointment and then get it inserted like me right here. These little knit holsters are so cute.
So there will be 2 cramps. The first one is me taking the measurement. The second one is the IUD actually going in, okay?
Okay. Did you have to dilate my cervix?
No, I don't think we're going to need to. Okay, so that was the first cramp. Just one more like that and then it's all done. Cramp once again. Just gonna trim me stings in your own room.
Ooh, not as bad as the first time.
Oh yeah? Any pain when I press there?
Nope.
On this side?
Nope.
Good. Okay, you're all set.
My gynecologist is a specialist at a hospital, and I picked it up downstairs at the pharmacy, then went back upstairs, and all of it was done within 15 minutes, and I was able to drive myself home. I think the first time I biked home, a super long applicator, and if you see the videos of it, it doesn't insert as a T. So it's not like they're inserting the whole T shape up your cervix. It's all very slim. Once it gets up to the cervix, they pull on 2 strings and then the T's open up. So it's not like they're forcing a huge T shape up your uterus. Huge factor in your experience about getting IUD is your gynecologist. So if your gynecologist doesn't have a good technique of insertion, your experience can be a lot worse. And I've heard lots of people who have had bad experiences. My family doctor, a traditional guy, said to me, I don't know why you would consider an IUD. I think of it as an older woman thing. That is a huge misconception. IUDs are one of the best contraceptives out there. Is it worth it? I have endo too and the pain is too much. I also get mega triggered from even a PAP. So really, I can't say this enough. If you find a healthcare professional that you trust, I find that sex clinics are the best. When I was very lost and I had so many questions, they're so patient with me and they're completely non-judgmental and they're very discreet. Even when they call you on the phone, they have a code word for it or a code name. And when they talk to you, they'll say, hi, this is Debbie calling. Is this a good time to talk? I would say get a female gynecologist. That's a good start, even though mine's male. I definitely had to gauge his vibes first before I was able to open up my legs to him. What does your gyno do that you like? Okay, Dr. P, he is he's such an angel. He's got a soft presence, soft spoken, but is very matter of fact. He will never judge me for anything. So we got a good extensive history, and then I'll tell him all my symptoms, and you can tell that he goes above and beyond for his patients because I'll say something like, oh, I've been spotting more than usual. My spotting is this color. And he'll be like, okay. Or even things like, how much do you pee? From his professional background, he's like, okay, well, I think we just want to double check for polyps. So let's go for an ultrasound here. I just want to make sure that you don't have a UTI. Not just, here's your endometriosis, let's treat it and see what it goes. So you know that he didn't rush treatment and he wasn't just like, okay, let's do surgery and then say goodbye and not follow up with any of your aftercare. For him to take the necessary steps to get me to my diagnosis and for treatment and all the little emotional things that he cares about. And you can tell that it's not just about treating that one thing, it's about the total care of you as a patient. An IUD can minimize to close to make your period disappear. Lots of people think of that as an unnatural thing. If that's what you're not comfortable with, that's totally fine. In terms of my situation, if I didn't have an IUD, every month I would be switching out super jumbo tampons every hour upon the hour, sleeping with a super jumbo tampon and a maxi night pad and still leak through it. Tried a Diva cup and like so much blood, can't get it to create the vacuum. I couldn't function with the cramps, and my endometriosis is mild compared to many people and cases that I've heard. This has been a godsend for me. I am so happy with my IUD. How does it help with endometriosis? I have to have the hormonal IUD. The whole reason why you have a lot of pain and heavy periods is the buildup of scar tissue in and around and outside of your cervix, so like where it shouldn't be. I mean, my periods are so light now. I have some cramping, very manageable. My cycle used to be every 3 weeks, 6 to 7 days out of the week. So that means that I would get my period twice a month, once in a while. And it would be a full week of bleeding. So now I have my period once a month, quite regular, track it with an app, and it's also very light, like super light. How are monthly cramps with an IUD? It's nothing compared to before I had the IUD. If you don't have endometriosis, I'm not really sure, and I don't really know how it affects your body. How much did it hurt? I think it's really hard to say. Lots of people are asking about pain. The first time I got it, it was painful. It is. I can't deny it, and it's not fun, but it's over in like 15 minutes. The first time, okay, there was so much pressure pushing down on me that I thought I was gonna shit myself on the table. And I asked my doctor, I was like, has anybody ever pooped on the table before? And he's like, oh no, it's normal to feel pressure. It'll be over in a second. And I'm like, no, I really think I'm going to shit myself. And thank God I didn't, but it really felt that way. I went with a friend who got it, and I've heard a lot of other people getting it, and it hurts so much for them, but it's a very temporary pain. It's only like 10-15 minutes, not even, tops. And it kind of just felt like my regular period cramps before I had IUD, but this one was short, so I don't know, it was great. Nothing a little Advil, or I actually would recommend naproxen or Aleve, because that's more of a muscle relaxant. Again, not a doctor, but that's just helped me more with my cramps. Pain rating for the IUD removal, very little.
I'm going to take the old one out first.
Okay. Does it hurt to take the...
Not too much, just like a tiny little pinch for a second.
Okay. If you're a woman, you deal with enough fuckery, you can handle it. You can handle it. Did you spot for like weeks like I did after you got it in the first time? I did spot. So the first time that I got it, I did spot for a while. I believe you can spot for up to 6 months. And as long as it's pretty light spotting, it should be okay. If not, definitely contact your doctor. The second time, so this time that I did it, no spotting. Right after the insertion, yes, a bit of blood. And then that was it. He gave me a pad, and I went home. When I went home and sat on that pad for the whole day, there was no blood. It was a clean pad. Incredible. I've been taking pills since I was 15. I'm now 23. I want to stop taking them. Is the IUD effective as pills? IUD is higher in efficacy than pills. Let me fact check myself. It's more than 99.9% effective at preventing pregnancy. Copper versus hormone. I know friends that have gotten copper because they don't have cramping and they don't really want to fuck with the hormones in case the hormones causes weight fluctuations, acne, or mood swings, which some people are prone to. So an IUD to me is more than birth control. If I had to use a different type of birth control, I would still use the IUD on top of that just to control my symptoms. But because it does both, knocks it out of the park, don't have to think about it for 5 years. Like, dope. Is there an IUD without hormones or metal? How are they different? So the copper IUD is a natural spermicide, so it's just a birth control. The IUD with hormones, depending on which one you get, serves different purposes in terms of birth control as well as helping with people with hormonal issues. So lesson of this video is you're female or female identifying, you can fucking handle this. You can take an IUD. The pain is only temporary. You must find a good gynecologist and really make sure that they have good technique for insertion. Make sure your gynecologist is thorough with you in deciding whether a hormonal one or a copper one is good for you or any other type of birth control. And I highly recommend it. I've had great experiences with both. So that is my takeaway. I love uteruses, uteri. I love and care for vaginas of the world, and I hope this helped. If you guys have any other female related topics you'd like me to tackle, let me know. And of course, we can always tackle it in a Girl Wow video about contraception. So ask all your questions and we will talk about it on the podcast. Thank you for listening. Thank you for watching. And I'll talk to you later. Bye. My stupid sister. Why were you born without a sense of shame or decency? Because I was related to you.